So right now, so we have mainly focused to begin with, we started with head and neck cancers because that was the expertise of the lab. So, and we also know that recently the drugs got approved for, the immunotherapy drugs got approved for being used in head and neck cancers. But again, like, it only shows response in 20 to 30% of patients. Most of them who get it do not respond. So now the next step is to basically look at what is causing them not to respond, or how can you differentiate between responders and non-responders, because you don't want to be giving the drug to everyone and eventually realizing that it's only working for few of them but not in the others. So if we could really predict the response, like, okay, these set of patients would be responding to these versus the others who are not, then we can definitely design the trials better, the treatment plan better. And the idea is that this protein can help us, like, we think it can predict clinical response to one of the immunotherapeutic agents. So right now we have validated these things in preclinical studies with head and neck. We want to go into other types of cancers too, because we don't think galectin, this protein, is limited to just one cancer type. We have seen this going up with aggressive cancers in breast, in lung, in melanoma. So we can expand this to other types of cancers as well. And we also, there are companies which are working to develop target this particular protein. We already have an antibody against it. So probably this could be taken further, but needs a lot more validation. So we are at the initial stages of all this, but it's definitely very promising. So we want to work further to establish how broad we can go and how much it is efficacious enough, and maybe eventually look at if it goes to trial in patients. We'll be really excited about it.